Hello everyone, I am Dr. E.T. Aaron Thomas. In this short video session, I am going to discuss with you a certain group of patients where you should not be very strict with regard to glycemic control. If you try for a very strict glycemic control, for these group of patients, I am going to tell you 7 group of patients. If you try to be very strict, you are going to harm the patient. You are not going to give additional benefit, but you are going to harm the patient. So let's see what are these 7 groups of patient. One is elderly. Elderly, definitely they have less life expectancy. So that means they do not have enough time left in their expected life expectancy to develop microvascular complication. Additionally, senile onset diabetes, studies has proved that the senile onset diabetes has less risk for developing microvascular complication, and also elderly are more at more risk for developing hypoglycemia. Second group is patients with long duration of diabetes. We all must understand the fact that the strict diabetes control in the initial years after the diagnosis of diabetes is much more important than the strict control in the later years. This is because if a patient had a strict glycemic control in the initial years, even if this strict glycemic control is not followed in the later years, still that patient will have less risk to develop microvascular complication. If another patient, if the initial years he didn't had a good glycemic control, but the later years he had a good glycemic control, he is having higher risk. So the good metabolic memory of the good glycemic status in the initial years will be carried forward. This is mainly through epigenetics. So in the later years, if there is no much role, patient needs a good glycemic control. That does not mean patient needs a very strict glycemic control. Strict glycemic control is needed in the initial years. Secondly, if there is a long duration of diabetes, patient can have diabetic microvascular complication. Diabetic autonomic neuropathy is one of the microvascular complications. If patient is having diabetic autonomic neuropathy, sympathetic nervous system may not be working very well. These patients have hypoglycemia unawareness. If there is hypoglycemia unawareness, if a patient develops hypoglycemia, his or her body cannot respond well to the hypoglycemia like tachycardia, sweating, hunger. If these warning signs of hypoglycemia do not come in, patient can go into severe hypoglycemia and it can even result in death and increased morbidity. Third group of patient is patients with chronic kidney disease. Is severe CKD. These patients have frequent hypoglycemia due to the following 5 reasons. Insulin is normally cleared from the kidney, so this may not happen if there is patient having advanced CKD. Secondly, 1/3 of the gluconeogenesis is from the kidney, rest is from the liver. So this may not happen in patients with CKD. In CKD, patients is having uremia. Uremia suppresses appetite. So patients will not or may not take good diet so that make him at risk for developing hypoglycemia. Many oral antidiabetic drugs are renally eliminated, either the drugs or its active metabolites. So this can accumulate and place the patient at high risk for hypoglycemia. Lastly, if the patient is on haemodialysis, most often the dialysate is glucose free, and during dialysis patients can have hypoglycemia. Because of all these reasons, because the patient is having or patient is at high risk for hypoglycemia, if you try for a very strict glycemic control, severe hypoglycemic episodes can happen. Another reason why we do not wish for a strict glycemic control in patients with advanced CKD is kidneys are already damaged. Kidney is one of the main target organ diabetes can affect. And why we are very particular about glycemic status for a normal patient is, one reason is to prevent this microvascular complication, to prevent diabetic nephropathy. Once patient is having diabetic nephropathy, already the damage has occurred. So what are you going to gain from a strict control? Your kidneys are already damaged, and also he or she can develop frequent hypoglycemia if we aim for a strict glycemic control. So we do not want a very strict glycemic control in patients with CKD. Next group of patients is patients having major cardiac issues. Whenever there is a hypoglycemia, we all know that there is sympathetic activation. Sympathetic activation can lead to tachycardia. This can result in increased oxygen consumption of the heart, and it can precipitate myocardial infarction. Sympathetic overactivity can also precipitate arrhythmias. So, we do not want hypoglycemia in patients with major cardiac issues because it can endanger his or her life. So, we are not going to be very strict with glycemic control. Second reason is, whenever there is an hypoglycemia, heart uses fatty acid. Fat as a source of energy through fatty acid oxidation. For oxidizing fatty acid, heart requires more oxygen than when it uses glucose. In patients with coronary artery disease, already oxygen supplied to the heart is less. What will happen if heart asks for more oxygen for oxidizing fatty acid? It can result in ischemic episodes or ischemic events. Due to all this, we do not want a strict glycemic control in patients with major cardiac issues. Next group is patients staying alone at his or her house. The reason is obvious. If there is a major hypoglycemic episode, there is no one to take the patient to the hospital. So it is very risky if you plan or keep a very strict glycemic control for this group of patients. Next group is patients who are heavy alcoholics. Heavy alcoholism predisposes an individual to hypoglycemia because this group of patients skips his or her meal very often. Additionally, alcohol consumption decreases hepatic gluconeogenesis. These two reasons make him at higher risk for hypoglycemia. So, don't be very aggressive in treating diabetes in these patients. We have to motivate the patient to reduce the alcohol consumption. Then only you can escalate the treatment for a more stricter glycemic control. Last group of patients are patients who are critically ill, patients who are in ICU. You all need to know this landmark trial, which is called NICE sugar trial. Here, in this trial, there are two groups. One group of patients received intensive insulin therapy for a strict glycemic control. Second group of patients had only conventional glucose control. And the result or conclusion of the study was, with the intensive insulin therapy for a strict glycemic control, there were more episodes or more incidence of severe hypoglycemia, and it also increased the mortality. Based on these results from the landmark NICE sugar trial, it is recommended that don't be very strict or aggressive with regard to glycemic control in patients in the ICU. Our target blood glucose level is only 140 to 180, and you will be using insulin only when blood sugar values are more than 180. So don't be very strict. These all what I need to tell you, the 7 group of patients. We all need to follow the basic ethical principle of practicing medicine, that is, first, do no harm. So do not harm these 7 group of patients with strict glycemic control. Thank you.